People often ask, well, why did I have a problem with penicillin when I was a child and now I can tolerate it? And I think that there's a few factors there. The first factor is that maybe the person did truly have an allergic reaction, they've lost that sensitivity or outgrown it and are now able to tolerate. The other factor is the most common manifestation of a drug reaction is a rash. Well, there's also lots of other reasons that people get rashes when they're sick. So maybe the rash that they had while they were taking the penicillin was not at all related to the medication, but was related to the illness that they had. And so that is what we commonly see, is we get a history that makes you wonder, was this really related to the medication and they were labeled as penicillin allergic or medication allergic, or was it really related to many of the other factors that were going on? And so that's where our testing is really helpful to differentiate. And if they have negative penicillin testing, there's a high likelihood that they'll tolerate the medication. Up to 90% of people that have reported having penicillin allergy, actually when we do the proper testing and then go on to give them the antibiotic, are able to take the antibiotic. And I think it's important for people to consider having this testing done because, as I mentioned earlier, the vast majority of people actually will tolerate the medicine, and penicillin antibiotics are still a very important antibiotic that are commonly used and tend to be more cost effective and more likely to have resistance to the antibiotics. And so it may be an important way for people to be able to take antibiotics that don't cost as much, work as well, and have developed less resistance, so that we can save those more powerful, broad-spectrum antibiotics for times when they're truly needed. They can call our clinic and we're happy to see patients, or call their primary care doctor, and the primary care doctor feels that they would benefit from allergy evaluation. We're happy to see patients that way also.